We're Peter and Catriona Waitts, and until 3 weeks ago, we were living and working in Kampala, Uganda, and we're currently working as consultant acute physicians in Liverpool. So, Peter, what were you doing in Uganda?
So in Uganda, I was working with the Infectious Disease Institute, building up a team to be able to respond with research to highly infected pathogens such as Ebola or other viral hemorrhagic fevers. Not just physically, but also building up their sort of psychological support mechanisms to protect the staff during any outbreak.
And I'm a clinical pharmacologist specialising in drugs in pregnant and breastfeeding women and their babies, but I'm also a consultant acute physician. And like many academics, our universities and funders contacted us to see if we wanted to support the NHS response. And we both felt that our skills would actually be better placed in the UK at this current time, which is quite unusual to be travelling in that direction. In terms of COVID in Uganda, how are things?
So currently they've got under 60 cases. They put in place a really early lockdown, which has benefits in terms of disease spread, but actually causes a lot of hardship for the population. Physical hardship, struggling to get to hospital when people are ill. Many people are day workers, and therefore that also produces hunger and other hardships, as well as spiritual hardships and churches not being able to meet, and less internet access for some people, and therefore more feelings of isolation within the church family.
And our role in our Ugandan church is still very active. A lot is taking place via internet, WhatsApp groups and so forth, and we're supporting our eldership in how to communicate about COVID. But in the UK, fascinatingly, UK is a much less Christian country than Uganda, and we've both been feeling that there have been many opportunities to share our faith, small conversations coming up here and there, much gospel opportunity, and that's quite exciting.
Yeah, I think to us that is the big surprise and the big encouragement, that we can talk openly about our faith in Uganda at work, and it's really enjoyable to be able to do the same here and be able to share why we have a confidence and why we can trust God and be anxious for nothing. That doesn't mean that we're foolish, but God has everything in control.
Thank you for your prayers.